Patio season is finally upon us, and as restrictions loosened over the weekend to allow Toronto bars and restaurants to open to outdoor dining for the first time in months, the city's top doctor is now saying there's clear evidence that show that Toronto is seeing a resurgence of the virus.
While I anticipate and am hopeful for a more relaxed summer, it's vital to remember it's still March. Summer is weeks away.
Right now, the numbers are going in the wrong direction. According to Dr. Eileen de Villa, variants of the virus now account for more than half of all COVID cases in Toronto. And among the variants, the reproductive rate is now up to 1.2, and that's cause for concern as active case counts are also the highest they've been in over a month.
So while it is right to be optimistic about what the vaccine means for you when you get it, it's necessary to remember the benefits are only reaching a limited percentage of people right now, and that each vaccination takes time to protect the person who got it. You know, there's no question. I've mentioned both at the Board of Health meeting this morning and this afternoon in my remarks that there is clear evidence of a resurgence of activity in COVID-19. And this is unfortunate. It's exactly what we don't want to see.
The province modified the gray zone lockdown a couple of weeks ago, allowing malls and retailers to reopen. And as of Saturday, bars and restaurants were allowed to start serving customers on Toronto patios.
It is up to people to decide if these very small additional liberties that were given in the last couple of weeks to allow retail to be open a little bit and to allow outdoor dining is something they want to see continued.
According to the latest numbers, only 7% of Toronto's population has received a first dose of vaccine so far, but supply is ramping up. By mid-April, all 9 of the city's mass vaccination clinics should be up and running with the ability to administer 18,000 doses a day. That's on top of the hospital networks, pharmacies, and family physicians also doling out the vaccine. But until at least 70% of the city gets the shot, Dr. de Villa says we still have a curve to flatten.
What is in our control, what's in our hands, is how we choose to behave and the choices that we make. And I know that if we make the right choices, as we have done before, that we'll put ourselves in better stead as a city towards getting back to life more like it was before there was such a thing as COVID-19.
Now, as of today, residents 75 and older in the city can sign up for vaccinations online. And as of mid-morning, the city says that more than 11,000 Torontonians had booked an appointment. Now, something else that's starting this week, the city is utilizing its library staff to reach out to seniors to let them know, make sure they know that they are eligible, and to give them all the information they need to get vaccinated.